Hello, everyone. It is an absolute pleasure to welcome you all at SensUs Student Competition Kickoff event. We are here today because of your passion, your curiosity, and your dedication to push the boundaries of the biosensor technology. We will start an evening with the theme announcement and the talk about why continuous biosensing is important. Afterwards, we will have the panel talk and we will close our night with the networking session. What is SensUs? SensUs is an international student competition on biosensors for health, but it is not only a competition. It is a platform that fosters innovation and collaboration in the field of biosensing. Our mission is to inspire students all around the world to develop new biosensing technology that make a profound impact on healthcare, improve our lives, and modify the future of medicine. To all the participants, we encourage you to embrace this opportunity, learn from each other, and most of all, remember to have fun. Teams will compete to make the fastest, the most precise, and the most attractable to market biosensor. It is your time to shine, to show the world what you're capable of. Just a quick appreciation to the SensUs team members that stand behind this competition. They find the partners, prepare the testing samples, and arrange the living places for you. So huge thanks to each and every one of them. After we play the after movie of the last year and see the recap, the founder and the supervisor of the SensUs team, Mano Prince, will come on stage to announce the theme of the next year.
Welcome to the SensUs Innovation Days, where students from all over the world have come together to showcase their biosensor to improve healthcare. Are you curious to see what it's all about? And come have a look.
We're here today because we are testing our sensors, and it's so exciting to see what we have been working for months come to life.
Today we are at the Partners Day of SensUs. For us as a company, this is a great occasion to meet students and to help them push the limits, really getting the most out of themselves. It is a win-win situation because it generates great ideas.
SensUs 2023 focuses on the brain, and the students have developed sensors to determine rapidly after an accident if brain damage has occurred. SensUs is a unique competition where students from all over the globe learn to work together and solve real-world problems. It's a life-changing experience. Hello, welcome students, student teams around the world. Welcome supervisors of the student teams, and welcome partners of SensUs. Welcome to this kickoff of the 9th edition of the SensUs competition. We are proud to have more than 200 registered participants this year, and a special welcome to 4 new kids on the block, 4 new universities. We have Cornell University in the United States, we have AgroParisTech in France, we have the University of Chemistry and Technology in Prague, Czech Republic, and soon also TU Munich in Germany. You've started on a great journey, which is your SensUs journey. And one of the special things of SensUs is that it has a different theme every year. In 2016, it was the kidney, 2017, the heart, 2018, infectious disease, and 2019, rheumatism, 2020, epilepsy, 2021, COVID times, influenza, 22, acute inflammation, and last year, the focus was on traumatic brain injury. In all of these years, the focus was on point-of-care testing. Point-of-care testing sensors are single-use sensors. So you take a single sample and then use it with a single cartridge. So for every new sample, for every new test, you need a new biosensor cartridge. Now, single-use sensors are not suited for performing frequent measurements. First of all, because it would be very laborious. And second, because you need so many cartridges that it becomes costly and economically prohibitive. So this year, SensUs is different. The focus is on continuous monitoring. And you, student teams, students, you will develop biosensors that are suited for measuring many samples, one after the other, on one and the same sensor. Therefore, the sensor needs to be reversible so that many samples can be measured. And this is a new challenge for sensor, but also for the world. Very little has been done in the field of continuous monitoring. And this is a new challenge with new application perspectives. Because continuous monitoring gives a continuous live view over time. So there will be lots of measurements with lots of data, and that means improved monitoring and improved treatment of patients. So this is the dream of SensUs, that you will develop new biosensing concepts that will allow the continuous monitoring of creatinine to improve the lives of kidney patients. So I wish you lots of success with lots of learning and lots of teamwork. And I want to thank you for joining this journey, for joining SensUs, and let's compete for quality of life. And now I would like to introduce Chris Vu. He will speak about what is this field of continuous monitoring, what's there to be achieved, what is it exactly. But before that, we look at the theme introduction of the movie that was made last year. Oh, sorry.
In the past 8 years, SensUs has focused on point-of-care testing. But now, it's time for a game-changing shift towards continuous biosensing. How? By looking back into the history of the SensUs competition. The first ever theme of the competition in 2016 was kidney failure, which is exactly what will be tackled in 2024. But with a twist. Kidney failure affects 2 million people annually. The number of patients diagnosed with the disease continues to increase at a rate of 5 to 7% per year, which makes it a global problem. In kidney failure, 80% to 90% of kidney function is lost, and waste products like creatinine accumulate in the body. This leads to symptoms such as itchy skin, swelling, irregular urine, fatigue, nausea, loss of appetite, and muscle cramps. Kidney failure can be found by the increase of the creatinine level in the blood. By monitoring biomarkers continuously, many patients can be helped, especially in chronic diseases like kidney failure. Instead of going to the hospital often to check your creatinine level only once every 4 to 6 weeks, a monitor could measure its level easily, whether you are working, playing sports, or just hanging out with your friends. Real-time monitoring enables early detection and facilitates personalized treatment enhancements. SensUs 2024 is going to find an easy way to monitor creatinine and help the daily lives of patients with kidney failure. We hope to see you there.
Hi everyone, my name is Chris Vu. I'm a PhD student at the Eindhoven University of Technology working at the Molecular Biosensing Group. Thank you, Manu, for your introduction. I also want to thank the SensUs organization for giving me the opportunity to talk about something that's very important to me, but hopefully will also be very important to the teams as well at home. The title of my talk is Continuous Biosensing, a next generation of biosensors. And with this talk, I hope after this you will have some kind of short overview of how this field looks like. I'd like to first start to talk about biosensors. Of course, the teams already know quite a bit what this is like, and if you don't, I'll still explain it a bit. A biosensor is a device that we can use to measure molecules of interest. And it does so by combining 3 elements. a biochemical recognition element that is able to bind the molecules with a binder molecule, a transduction element that is able to transform or convert this binding event into some kind of signal, whether that's optical, mechanical, electrical, or electrochemical, and also a detection element that is able to convert this signal into something that we can interpret, a concentration value. And as Manu already mentioned, we use these biosensors mostly for endpoint measurements. And the question that you need to ask yourself, is this sufficient? Because biological processes, they don't stand still. They are not static. They are quite dynamic processes. Take, for example, the case of a cytokine storm. A cytokine storm being a very excessive and uncontrolled release of inflammatory markers that can lead to organ failure and even death. You can already see on the graph on the right how all these different inflammatory markers, TNF-alpha, interferon gamma, IL-6, etc., how they rapidly change over time. And this is very critical for the clinician to be aware of this, to know how these concentrations change, because if you don't know this, you don't know how to treat the patient the best way that you can. So we need a way to monitor all these different types of biomarkers. Do we have the devices for this? Yes and no, because we do have a lot of analytical devices, and they are quite sensitive. But there are some barriers that we need to go through in order to monitor concentrations at a frequent rate. One challenge is that these devices are very bulky. They require specialized equipment, so they are often used in a laboratorium. And this brings a lot of other logistical barriers or challenges, because you need to transport the sample to the clinical lab, you need to do some sample preparation in the lab, you need to measure, and then you can communicate the results of this measurement to your clinician. And this entire process can easily take up to a day. While in an ideal setting, we would have a sensor that is connected to a patient, that is able to measure all these different levels of a biomarker over time. And if the sensor is integrated into some kind of closed feedback loop, it is also able to trigger the release of some kind of drug or medication in order to help the patient when elevated levels are measured of a certain biomarker. So what kind of device do we then need? What does a continuous biosensor then actually do? And before I get to this, I first need to go through some boring stuff, which are the definitions. And I think knowing these definitions and differentiating between these definitions is very important to understand what you're working with. The first thing that I already mentioned is continuous monitoring. And when I talk about continuous monitoring, I'm talking about the repeated collection of measurement data at set points in time with a set frequency. It doesn't matter how slow it is, how fast it is, as long as it happens with a set frequency, we call it continuous monitoring. This is different from real-time biosensing. And when we talk about real-time biosensing, we need a sensor that is able to perform measurements with a short sampling to read out delay time. So from the moment you take a sample to the moment you see a value popping up on your screen. And this delay time should be short with respect to the concentration fluctuations in the human body or in disease. And I will touch up on this on the next slide. When we talk about a continuous biosensor, a continuous real-time biosensor, we're talking about a sensor that is able to perform repeated measurements, but also does so with a frequency that is fast enough to keep up with all these concentration fluctuations in the human body, in disease, whatever. And this delay time, the sampling to read out delay time, how fast it needs to be is relative to how fast the processes change in the body. Because for each disease, for each molecule, the rate at which they change is all different. It's not the same. So you can imagine if you have a sensor with a certain delay time that works for an analyte like cortisol, that has a fluctuation time of about 4 hours, this delay time might not be sufficient if you apply it for a case like insulin, where the fluctuation times are way shorter. So minimizing this sampling to read out delay time is one of the most important aspects in developing a continuous biosensor. And throughout this process, you will you will see three things that are kind of limiting this time. First being the sampling time. How fast do you transport your sample to your sensor chamber? Will you do it with a pump? Is there flow? Will there be continuous flow? How fast is this flow? You have to deal with reaction rates, with the kinetics. How fast does your reaction actually occur in your system? How long do you need to incubate your sample for before you can perform an accurate measurement? And lastly, also the data processing. You need to have an algorithm, a script, some kind of model that is fast enough to perform your analysis. And that shouldn't limit your sample to readout delay time. One thing I want to touch on specifically is the sampling part, because within this competition, you will be working with creatinine that we will sample from interstitial skin fluid. And in literature, there has a lot of research been done on developing all kinds of sampling methods to extract this fluid and also the biomarkers from this fluid. For example, very classical methods, such as using a wick that can absorb the fluid from the skin after insertion with a needle, or a bit more modern, relatively more modern methods, such as a microdialysis probe or reverse iontophoresis. One of the most successful biosensors is also sampling from ISF. And this sensor is something that many of you will also probably know, which is the continuous glucose biosensor. And the continuous glucose sensor it's very interesting. It can measure every minute. It's stable for up to 2 weeks, and it's very impressive. And it's also able to be combined with the insulin pump, so you can also use it in a closed feedback loop. The thing with this sensor, though, is that its measurement method is not really translatable to other biomarkers, because this transduction principle of the sensor relies on the use of an enzymatic reaction, and that is, of course, not always available for other biomarkers that we're also interested in. So a lot of the recent research has delved into trying to develop sensors that make use of reversible molecular binding. So when we work with reversible binding, we're working with binder molecules that can bind and unbind from the analyte of interest, such that it is possible to measure increasing and decreasing levels of concentration. And I've put a few examples here on the slide. So recent examples are the electrochemical aptamer-based sensors being developed at the University of California. We've got fluorescence-based molecular switches being developed very recently at Stanford University. And within our university at Eindhoven, we're also developing particle-based sensing methods allowing for continuous monitoring. What all these methods have in common is the fact that, again, they use reversible binding, but they also don't consume any reagents. And this is very nice, because this means that these methods are able to be used for long-term periods of time. Hopefully in the future, we'll be also able to integrate these types of sensors into the clinic. You can imagine a system where when a patient is in the intensive care, you can have continuous sampling methods, such as, for example, a microdialysis probe being inserted into a patient, being able to sample from the blood, transporting it to the biosensor. Here in this case, we use the particle-based sensing method, BPM. You can communicate this data to some kind of model that can interpret this data and also regulate some kind of IV drip, allowing for the administration of medication if it's necessary. I'd like to end on this note, and there's some takeaways that I want you guys to take from this. The first one being that we need continuous monitoring or continuous biosensing to resolve biological dynamics that can aid clinicians in seeing how diseases develop in patients. We need the real-time aspect in order to be able to keep up with all the concentration fluctuations of a certain disease, and this requires you to look at this sampling to read out delay time. And this should be short, again, with respect to your application of interest. And finally, there are some aspects in the presentation that I already mentioned that you will also need to incorporate into your sensor. For example, the reversibility aspect, where you need to deal with increasing and decreasing levels of concentration. You need to have a sampling to read out delay time that is short with respect to the application of interest, and also your sensor needs to be used for longer periods of time. And with that, I want to thank you all for your attention, and if there's any questions, feel free to reach out. Oh.
Thank you so much, Chris, for your presentation and sharing some insights on continuous biosensing. Yes, yes, yes.
Yes, thank you so much.
Good evening, everyone. My name is Zofia, and I'm a proud SensUs member. It's a privilege tonight for me to host the panel session. Our conversation tonight revolves around the kidney failure, aligned with the SensUs 2024 theme. We encourage the audience to participate by asking questions with the YouTube channel. Towards the end of the panel session, as well as during the session, we will ask those questions to the panelists. Let's take a moment to welcome our esteemed panelists for the session. Valerie van de Vlier, Dr. Charles Bernhout, PhD candidate Claire Michelsen, and also Shireen Dunn, SensUs member. There's some water for you. A very good evening to each of you, and thank you for being here with us, first of all. First, I'd love to start with getting to know you a bit better. So could you please share a brief introduction about yourself, and perhaps we can start with Valerie?
Sure. Hi, my name is Valerie van de Vlier. I'm a kidney patient. I have ADPKD, a genetic disorder that basically ruins your kidney function. And I have received a kidney transplant about a year and 3 months ago, which is, as far as I know, I actually just got tested again today, my creatinine, so very, very interesting what's going on here today again. So as far as I know, I'm doing really well with my new kidney, so that's why I'm here to share the patient perspective.
Thank you. Charles, could you say a few words about yourself?
Yes, I'm Charles Beerhout. I'm a doctor in internal medicine and nephrology. I'm practicing in Veldhoven in the Maxima Medical Centrum since 2003. And before that, I had my education in the Catherine Eindhoven and the University of Maastricht. And my specialty is dialysis, acute kidney failure, chronic kidney failure, and the treatment of patients after a kidney transplantation. Like my neighbor. What you see is that the first year they will be treated in an academic center, and mostly after a year they will go back to the center where they are sent from. So I hope I can help you.
Thank you. And Claire, could you also give us some insights on your background?
Yes, so hi everyone, I'm Claire, and I actually studied here at the University of Eindhoven. I studied biomedical engineering, and the molecular aspects of biology have always been of high interest to me. So I continued after my studies doing a PhD. So now I'm a third-year PhD, and I'm focusing on continuous monitoring of proteins, which Chris just nicely described is still a big challenge in the current research field, but it's also a lot is happening as well. And you feel it starts to increase, and we're learning more and more. So that's very exciting.
Thank you. And finally, Shireen, could you share a few words about yourself?
Yes, my name is Shireen Dunn, and I'm currently the Chair of Technology at the SensUs organization, and I'm here to answer any questions that the student teams might have. Yep.
Thank you so much. All right, so thus let me begin with the questions. We can start with Charles. Charles, specifically in the field of nephrology, what are the primary challenges you face with existing measurement methods, and how do you envision innovative sensing technologies to address them, if at all?
Yeah, I was afraid that you would ask this at me, because when I heard about the project about continuous measuring about creatinine levels, I was thinking by myself, I don't know, what will we use it for? And the aim of projects like this is that you look from a different side to the problem, and maybe you give us new insights, what we can do with it. I was thinking a lot more, and what I could think about that at present, if a patient comes to me, like Valerie, she goes to the laboratory, they will take a blood sample, and within 2 to 4 hours, I will know the result. You can think about patients with chronic kidney failure, maybe after a kidney transplantation, where we know that the variation in creatinine levels can be very high and could be also of importance to know at time. Because if you are waiting too long, then you can have an acute reaction or side effects of the medication. So you can think about a patient with a kidney transplant, maybe especially in the first months or years after a kidney transplantation, it could be of a big value to have a continuous measuring. And the other thing I would thinking about, Chris was telling about the glucose and the loop system of diabetes and insulin. I know in Maastricht they are thinking about a method of dialysis, patient with chronic renal failure with wearable dialysis system to mimic more the old kidney. And you can think about if you have a closed loop, because my kidneys will work when they sense that my blood values are higher. And you can think about a system that the dialysis, the wearable dialysis maybe would work harder or slower, depending on especially a creatinine level.
Thank you. Valerie, reflecting on your journey, could you share some insights on the principal biomarkers that are currently being tracked in the kidney disease management? And also, what types of biological samples are used?
For me right now, after transplant, it's one of the most important is indeed creatinine. And the base levels of my medications, my immunosuppressants, are very important. Because not only do they keep the new kidney in check, but they also, unfortunately, are horrible for your kidneys. So you really don't want to have too much of that in your body. So those are very important. For me personally, also, my hemoglobin is very important because that just has remained low for a very long time. So that is also one that seems to be fairly easy to measure if I see it, how quick the turnaround of it is in the lab. And really important, especially also before transplant, because and during dialysis it fluctuated a lot, and there are some other options with medications becoming available, but for a long time the only option was to give yourself a shot every week or 2 weeks or month, depending on your levels, and it would be wonderful if you'd know when you need it. But yeah, as Charles said, right after transplant, I had to get my blood checked for the creatinine so often, so very, very often. While I was in the hospital, it happened constantly, but also the first month or two after, I had to go to the hospital 3 times a week, which was basically just to measure the creatinine and the med levels. If that could have been done at home, that would have saved so much time, not only for me, but also the first couple of weeks after a transplant, after a big surgery. You're not allowed to drive, so you need someone to help you with that. And if you could just have a wearable somewhere, or even just a finger prick or whatever, and do that at home and send the results to your doctor, who says, well, put your med levels up or down a little bit, that would make recovery so much easier too. So yeah, those are things where I think it would really, really, really help for a patient, make life a lot easier for a recovering patient.
Yes, of course, I definitely see your point. And Charles, now we ask you, are there any additional biomarkers used?
Other biomarkers in kidney failure?
Yes, yeah. yes, in kidney failure.
The creatinine level is just one thing you measure, and it gives a little bit of an estimation of how good or how bad your kidney is functioning at this moment. We are also looking to things like sodium, potassium, especially potassium, because we know that high levels could be dangerous for a patient, and low levels also. But there are more things depending. Valerie was telling about the medication, the immunosuppressiva, but also think of the hemoglobin level. The kidney is not only the creatinine level, but also all the things we already mentioned.
Mm-hmm. Thank you. And Valerie, considering the patient's perspective, where do you see the potential for meaningful enhancements that can be done in the existing biosensor ecosystem?
Well, right now everything is done for kidney patients just in the lab. You go in and they draw your blood and it goes to the lab and that's it. So basically anything where you don't, if the base markers that are important for you at that moment can just be done continuously, while the other things that are also very important are done less regularly, just when you actually go to see your doctor, because obviously you still need to see your doctor once in a while and talk to them. But
course.
if you don't have to go in all the time, I think that's where the big win is for patients. And it would be lovely if it could be personalized a bit, indeed, with some of the markers Charles mentioned, like potassium. Before transplant, mine was just rising constantly. After transplant, it could hardly come up. Those kind of markers at that moment would be useful for me, while my sodium levels have always been fine, so that doesn't really need to be checked. Stuff like that. Yeah, if you could make it patient-specific, that would be wonderful. If a doctor could just say, like, okay, I have a device here, and for you, it's measuring this and that and that, and okay, and after a few months, okay, well, that's actually really stable, but that and that is changing now. That if something like that would be possible in the future, that would be amazing.
Thank you. And Charles, from the physician's perspective, do you see also any field for improvement, and where?
Yeah, I think there will be an improvement, what we're telling about after a kidney transplantation, because patients who get a kidney transplantation, before that they were depending on dialysis, and they know what it is, and they never want to go back to dialysis again. And for them it is very important to know how their kidney function is at that moment. And we often get calls from patients who are having a cold or getting other medication and don't feel well. And the main thing they are always concerned about is their kidney function. Please don't let my kidney function go down. Don't get me back to dialysis.
Thank you. Claire, could you take a moment to explain, from a research standpoint, how to define a continuous biosensor?
Well, I think Chris just did a very nice job at that as well. But so a continuous,
just in short,
so a continuous sensor is where we are have a continuous stream of data and at a set time point, at set time points that you measure all the time.
Of course. I think we have the question from the audience.
Yes, one of the teams had a question. How did we define that the measurements should be performed every 5 minutes? Does this depend on the time creatinine rises, or is there some other reason? In the competition for the...
Well, there is no set time period, as in it needs to be measured every 5 minutes, but we will provide you with 24 samples, and you're expected to do as many as you can within 2 hours. So, yeah.
Hope it answers. All right, Claire, and considering the traditional single-use nature of point-of-care biosensors versus the potential for continuous monitoring technologies, could you discuss the advantages that continuous biosensing might offer for the management of kidney disease?
Yes, so to me, continuous sensing, also the plot that was shown is that you have this continuous stream and you look at a complete trend instead of some snapshots, because there can be peaks in between and lower levels, and these are the ones that you're missing if you only measure 3 times a week, you were saying. So you have 3 data points, Well, continuously you would see the whole trend. And I think that from a research perspective, I think there's a lot of that we as researchers can still learn from that. And I think there can be new information there as well. Yes, and of course, every patient is different. So it also becomes more personalized.
Charles, would you like to add something to from your perspective to the topic? Maybe.
At this moment, if a patient has chronic kidney failure or after kidney transplantation, we measure the creatinine level every 3-4 months. And what you are saying, there's a peak, depending on what they eat or depending how much they drank, the weather outside, what they did, how much muscle they got, do they go to the gym or not. So we don't just have a snapshot, what you are saying. And maybe it will give more information if we have a more continuous censoring of the patient. I don't think we have to measure it every second or every 5 minutes, but maybe it's more than once in 3 or 4 months.
Yeah, I think indeed that's a very important aspect of continuous sensing. You need to look at the application and what is required. Because of course we can measure, if it's possible and your sense is very fast and you can measure a lot, but you also create a lot of data and other challenges come with this as well. So you really need to analyze your problem and see what is really necessary, because we don't need to over-engineer.
Yes, do you want that?
Yeah, could I add something? I think that also, in addition to what Charles is saying, for patients it could give some peace of mind. Even like usually you go every 3 to 4 months, but especially because there are sometimes peaks and it goes up and down, and I know that and I realize that. But it might be good for a patient to realize if like for a month it's been monitored maybe once a day or something, and you see that in that month it goes a little up, a little down, and on average it stays about the same. That might, but it does have peaks sometimes that might give people the peace of mind that when their doctor says, "Oh, you're doing fine, you're in an okay range," that you're not staring at a chart and thinking, but it's 10 points higher than last time, because you know that it can fluctuate 10 or 20 points or whatever. I know that in different countries they have different measurement systems. So in some, I know that in some countries 10 points difference is really bad, but in the Dutch system 10 points up or down is not that big a deal. It's nothing, but for a patient, if you suddenly see it and you go from 91, which is on the brink of healthy, to 100, you think, oh my goodness, it's gone up 10%. That's horrible. Well, it could just indeed be that you didn't drink that much that day, or you have a slight cold, or you ate something salty the day before. Which isn't a big deal at all. And if you could see that, if you even just for 1 month every year or 2 years or whatever, can see that trend and realize, oh, it goes up and down constantly. There's just a 20-point change overall the whole time, then it doesn't worry you so much. And I think that for a patient, that peace of mind is a really, really good thing, because as a patient, you get nervous. Indeed, like Charles said, especially if you've done dialysis, you do not ever want to get back on that. So it's nerve-wracking when you see, oh my goodness, it's going wrong.
Yes, definitely. I think we have the question from the audience.
Yes, this question actually relates to the story a bit. One of the teams asks, from a patient perspective, what are the expectations for the user interface of the sensor?
Lovely acronym KISS, keep it simple, stupid, works for things like this really well, because not every kidney patient is the same. And there are elderly people. There are people who are not as not as well educated as others. Some are, some aren't. So it needs to be easy to understand and easy to monitor yourself, to do the input and everything. So you can easily go to your doctor and say, "Hey, I see this," and that you don't keep. I mean, Charles would not like it if people would start calling him every half an hour, like, "Oh, there's something wrong with." So it needs to be simple. The simpler, the better.
Thank you. All right, and Claire. What are you excited and anticipated to see with regards to the development of continuous biosensing?
So I think one of the biggest challenges is that if we want to measure continuously, we need to be reversible. And reversibility can be a challenge. So I look forward to what we will accomplish in research to reach this goal, to be reversible.
So the solution to reversibility.
Yeah.
All right. Do we have any questions? Oh, yes, we have one.
Yes, two actually.
Great.
So, first of all, how precise should the measurements be to be the most useful?
The problem with the creatinine level is that it's very fluctuating. So if you give a device to a patient, we have to firstly educate them perfectly so they know how to interpret it. You have to look to the longer period and the trend you are seeing. In daily practice, it's not abnormal that you see a change in creatinine level of 10 to 20 points, micromoles per liter. That's normal. And that's what Valerie is saying. When the patient is coming for the first time at my clinic, what I do on the computer, I can show them the graphs and then can show them, then it was 20 points higher, now it's 10 points lower, then it will be 20 points higher. So 10 to 20 points variation is thinking acceptable. Yeah.
Okay, and then another question from Team GLA Sense. Are there any emerging technologies or trends in biosensing currently that they should be aware of?
Can you repeat?
Yeah. So are there any new emerging technologies in the field of biosensing that the team should be aware of?
I think the slide from that Chris showed with that really nicely summarized if we talk about continuous sensors in the current research field, the latest developments. That's a nice summary. So we have the electrochemical APTA sensor. We also have the fluorescent switches and the biosensing by particle motion that I actually also work on.
Are there any more questions?
Yes. From a physician's perspective, what challenges exist for kidney patients with comorbidities who might need to dosage medication based on current kidney function?
Sorry, nog een keer.
One more time?
Can you repeat it, please?
Yeah.
Sorry.
So from a physician's perspective, what challenges exist for kidney patients with comorbidities who might need to dosage medication based on current kidney function?
Not all, but many medications are depending on kidney function. So we have to change the dose if the kidney function is going up or down. You can think about diabetes medication, the tablets. Some tablets like metformin you can't give if the kidney function is below 30, but also antihypertensive medication or antibiotics. There's that medication you have to change the dose and the frequency if the kidney failure is going up or down.
Gout medication.
Gout
I have
medication.
Experience with
many medication. Antithrombotic medication. You can go on almost, I think, 1/2 or 2/3 of the medication you have to change the dose depending on the kidney function. There are many books written about it.
All right. Are there any questions more?
Not currently.
Not currently. All right. Thank you so much for being here with us. That's all my clear questions. If there are not questions incoming from the audience. Thank you for all your answers, sharing your knowledge, insights, and being here with us. Yes, I think. Okay. Thank you so much. Thank you so much for joining.
Thank you.
Thank you so much. Thank you. All right, and now we will have a 5-minute break. Welcome back, everyone. Now it's time for the partners' presentations. Following these presentations, you will have the opportunity to ask questions during the networking sessions to the panelists and the partners. So save your questions. Our first spotlight tonight is on PalmSense, committed to simplifying electrochemistry, enhancing portability, and increasing accessibility for both novice and advanced researchers and entrepreneurs. For a more in-depth understanding of this company, I encourage you to watch the accompanying video.
Turning an electrochemical application into a commercial product is easier said than done. Your resources are limited, and speed is essential as the time to market is now. Our OEM potentiostat products allow you to translate your sensor application quickly into an end-user device. We deliver a full end-user potentiostat or reader tailored to fit your application and brand, starting at low quantities. You can customize your market-ready solution by selecting the housing, the module, the battery, and wired or wireless connectivity. Our solutions will help you to accelerate in making your electrochemical application ready for commercial use. PalmSense can deliver a custom app for your sensor application, or you can make it yourself using our software development kits and code examples. Contact us for more information or visit our website, palmsense.com/OEM.
Moving on, we have Unitron. And Unitron specialists dedicate their efforts to developing and producing medical products that significantly impact healthcare. I'm delighted to introduce and welcome Maria Doulard-Debord, who will provide a deeper exploration into the company. There you go.
Thank you. Okay. Good evening, everyone, and good morning to some of you somewhere over the world. I'd like to introduce you quite shortly, as a bit, our Unitron company. I think what makes us quite specially in the world is that we have only one scope, and that is building medical devices. So that is where we have a dedication for. A challenge. You all have stepped on this podium and accept the challenge. So I think this is something that you are dealing with right now. Be creative, be efficient, and look ahead. How do you do that? Most of important is that we have 3 sites. We are located in Hengelo and IJsendijk. IJsendijk, we have the production site. Our R&D department is divided between Hengelo and IJsendijk, and we have an office in Ghent. We are now more than 35 years busy in building medical devices and have more than 58 people working in our ecosystem and 120 overall with different kinds of suppliers. We have specialists in FDA and MDR and compliances, and definitely have all the knowledge about production. Also, our R&D department basically has specialized in the one-piece flow, but also in scale-up-ability, but also high-volume products. Our services, R&D, design transfer, production, regulatory support, and after-sales. So also the whole repair system is with our system. How do we do that? Is that we have knowledge about the ecosystem of our customers. So the Gartner Hype Cycle is one of the things that we have quite a lot of knowledge of. You can find the white paper on our website, but definitely this is one of our scopes of our quality system. And this basically, ask questions later on in the network event, but we can definitely help you where you are in the development phase. Some products and then you can see the variety of products we are developing. Some are already pitched, some are within a launch on the FDA side, or are waiting for a notified body pitch momentarily. Conclusion is define a plan and your processes of each topic in the challenge you have accepted. Make sure you have the right cross disciplines in your team. See each other, work like a team, create the correct scope. So why are you doing this? Why are you developing this? And why this antibody or this solution you want to develop? And think ahead in the next step of development. So also think about your components, the sourcing part, quite important. So be creative, be efficient, look ahead. See it as 6 blocks and the question, building a duck. This is what you get. Everything is good, but work together. Good luck.
Thank you, Maria, for your pitch and joining us today. All right, moving forward, we are transitioning to the networking opportunity with the panelists and the partners. Teams should have already received a link and a schedule for the respective sessions. With this, we conclude the official part of the event and encourage everyone to actively participate in the networking session. Have a fantastic evening, and thank you for joining us today.